few housekeeping items.
I'll work on it.
Afterwards, after the meeting, there is a social event at Red Lake Brewery following the meeting, so I'd love to see you guys out there. If you have questions or need directions, feel free to contact me and direct you out there. Right now, we're going to do the MedPhys Slam. So for those not familiar with the MedPhys Slam is, it is a competition that AAPM puts on. They're designed around being a 3-minute elevator pitch that you would give not to another physicist about your research, but to the general public. And the idea is, as physicists, we need to improve in our communication skills. And so this competition is going to be 3 minutes to describe your research to someone who's not a physicist and tell them why it's important. And so the winner of our MedPhys Slam is Rubin, and he will give his talk, and he'll then be presenting at the national conference in Vancouver.
Thank you.
So normally we've done it in the past where they're like record a YouTube video, but he's going to do this live, so that's good practice. So
my video is like super grainy. It was late, so I figured this would be a good, alternative. So yeah, I'm Rubin. I am the first-year resident at the Huntsman Cancer Institute at the University of Utah Health. I went to school in Rhode Island, University of Rhode Island. I got my master's in medical physics there and stayed on for a PhD in physics before getting matched to the Huntsman. So this is my little talk on balancing efficiency and accuracy, breast tangent image guidance. So this is going to be looking at breast tangents and pulse and stuff like that. So yeah, as Olivia mentioned, it's supposed to be for the general public. So I'm going to say things that you guys know or explain it super, rudimentary. Okay. So whether you are at a small clinic or a large center, efficiency in treatment delivery without degradation of your clinical outcomes is critical. Breast cancer comprises approximately 1/3 of all new cancer diagnoses, and therefore it's a common treatment area for radiation therapy. We commonly treat these patients with a pair of tangent treatment beams, approximately 180 degrees apart from each other. We call them tangents. A patient before treatment can be initially set up using cameras called surface guidance. They can then be treated or imaged with orthogonal pair of x-rays to help align the anatomy. So that's similar to what we planned for. And then the third and final image can be taken from the treatment team's point of view to ensure that the target is within the treatment's field of view. And we can also make shifts off of that last image, which we call a portal image. However, there are some geometric uncertainties with making shifts off of these portal images. Our clinic proposed to save several minutes per patient by making shifts directly from port images and bypassing the orthogonal x-rays. And our physicists, actually Ryan here, characterized like how that would look, and it's a change in the treatment source to patient surface distance, what we call SSD. And so the question I had was, if we know that this error exists in shifting off of ports, does that matter geometrically? So I took 10 patients that were treated with breast tangents and adjusted the SSD and looked at the result of the dose distribution. We noticed and expected that the target coverage would decrease as seen in this bottom left plot. And we also noticed that there would be the formation of hotspots, which are circled in those blue areas on the x-rays to show the progressing, the increase of a hotspot within that circle from left to right. And although they may look like there's some major deviations with these changes in SSD, shaded in light blue on the plots is the area we find to be clinically relevant as far as an SSD change. Because we're fairly confident that our positioning with surface guidance puts you around a centimeter of accurate positioning. And so from shifting off ports after that, we believe that the correct or the uncertainty in our SSD would be sub-centimeter. So that's why that area is shaded. Overall, we find that the coverage decreased by less than 0.5% in that clinically relevant region. The hotspots increased by less than 1%. And in our left-sided breast patients, the max dose to the heart increased, but still by less than 4%. And the overall mean dose to the heart there was no negligible change in the mean dose to the heart. So our breast tangent plans are designed to be robust to changes in patient anatomy as inflammation and weight change happen throughout the course of treatment. And these results show there's actually also robustness to some minor deviations in treatment setup. And so our physics team found that this was clinically acceptable or clinically acceptable for use in the clinic to shift off of ports with the use of surface guidance pre-positioning. And if anything, it also reaffirms our confidence in the robustness of our treatment planning process for breast cancer patients.
Good luck at the national conference.
Yeah, I'll put it on the live one.
Yeah, it's a good reminder as physicists that we should always be able to explain what we do and our value to the general public, not just our colleagues. So